feels right. Don't overcomplicate, just say hi or whatever it takes to break the ice. Don't walk away, there's more to say. I just need the courage to let you know what's on my mind. Like every time we pass by, something just feels right. Not empathy, it's energy locked up, it's ready to scream and shout. I won't make the same mistakes twice. Ready to shake up and break the ice. You have a roadmap that I can try, 'cause I think I just got lost in your eyes. I have to tell you, I really want to. Whenever I look in your eyes, I won't make the same mistake twice. I'm ready to shake up and break the ice. Don't walk away, there's more to say. I just need the courage to let you know what's on my mind. Like every time you pass.
Okay, hi, very good evening. So this will be our final session for discussing a NEET MDS paper, right? So in this session, we'll try to complete off as many questions as we can, right? So very good evening, all of you. Hi, Manisha. Hi, Srish. Hi, Alvin. Hi, Navya. Hi, Shilpa. Hi, Nisha, Richa, Rupali. Hi. Hi, Abba. Hello, Kartika. Very good evening. Okay, so rather than, as I said, as I've been doing since 2 days, so rather than going into discussion, we'll just try to have a summary of all the questions and related topics, if any, rather than going deep into discussion. Because once we start discussion, then it will be taking obviously more time, and because of time constraints, we might not be able to complete our entire discussion, right? Okay, so we'll start off with the first one. Right, so as I said, we'll try to wind off with this third part. So regarding adrenal concentration in emergencies, right, usually 0.3 to 0.5 ml of adrenaline is administered intramuscular, especially in cases of emergency, right? So you can just note that point as well. So adrenal concentration in case of emergencies. Okay, yeah, just give me 1 second. Yes. Yeah, high moment. Right. So next, so that's pertinent adrenal concentration, right? And we have also one query on visor osteotomy. So visor osteotomy. Okay, so this is a vertical osteotomy. So we have horizontal or vertical osteotomies. So this is a vertical osteotomy, and it's mainly done to increase the height of mandibular ridge, especially in cases of atrophic mandibles, in order to provide denture support. Right? So there is central splitting along buccolingual direction in case of vertical or visor osteotomy, named after the person who has introduced this technique. Right? Yeah, as we discussed, Ankita, previously, as 1:1000 intravenous, because we have different routes. In fact, we have intravenous, intramuscular, or even intracardiac. As based on the options, they're given you subcutaneous and intravenous, right? So obviously, subcutaneous can't be used. There will be because of shock, already the blood vessels are in state of constriction, so there won't be much uptake, right? So obviously, it has to be intravenous. I'm just telling you for sake of information. So I've referred Tripathi. We have this information where in specific in case of emergencies we go with 0.3 to 0.5 ml, especially in case of anaphylaxis, right? We're talking about anaphylaxis. 0.3 to 0.5 ml of adrenaline intramuscular is the route of choice, right? And also drug of choice. And also there was a question on surveying, right? So surveying and order of components of surveying. So once I refer public health dentistry, we have the following steps in survey. So I'll just give you the steps. So based on that, you can arrange the options accordingly. And I hope it is streaming fine, and I hope you can see what I'm writing on board. So steps in survey. You might have gone through, yeah, hi DA, good evening. You might have gone through the same topic in your undergraduation, if I'm not wrong. So the first one is establishing objectives, like what you want to do and what information you want to obtain. And then designing the investigation, like how you want to do the study. And then selection of sample, which is very important, followed by conducting examinations. And then after collecting the data, after examination, analyzing the data. And then trying to draw conclusions and putting the results finally. Right? So based on this, you can divide your options accordingly into introduction, methods, materials, conclusion, and result. Right? So that's a basic layout from which you can have your answer. Next, there is a question on carbamazepine. So in fact, there are a lot many questions in pharmacology, if I'm not wrong. So carbamazepine has adverse effects. It has this tendency to cause bone marrow suppression, thereby leading to aplastic anemia. Right? So aplastic anemia and aplasia, right? So recurrent thrombocytopenia, anemia, and leukocytopenia. Also, other side effects of carbamazepine include neurotoxicity, vertigo, diplopia, etc. So, adverse effects of carbamazepine, CBZ, in short form CBZ, right? Okay, Srish, thank you for giving the feedback and for letting me know how it's going on from your side. So also there were several questions on drug interactions, right? So oral contraceptive pills and tetracyclines. So obviously, if you refer, it's mentioned that antibiotics, when taken through oral route, the deconjugation of estrogens, contraceptive is estrogen. So the deconjugation of estrogens excreted in bile doesn't occur. So there is no deconjugation. As a result, enterohepatic circulation of this estrogen is affected, leading to decreased level of estrogen. Hence, ovulation occurs normally. Hence, there will be failure of contraception when you prescribe a patient who is on contraceptives, tetracycline, right? So that's the kind of interaction we have, right? So antibiotics, especially tetracyclines when given orally, deconjugation of estrogens excreted in bile doesn't occur, and their enterohepatic circulation is interrupted, blood levels fall, ovulation occurs, contraception fails. So there is one question related to that, if I am not wrong. Next, toothpaste composition we discussed just one day before the exam about humectants. Humectants, they're nothing but moisturizing agents. So we have various humectants like glycerol, sorbitol, or propylene glycol, right? So what was the previous one we discussed? Oral contraceptives and tetracyclines, right? Next, components of toothpaste humectants. Okay, right. So regarding placenta, origin of placenta, from which tissues the placenta is formed. So placenta is derived from infants as well as from maternal tissue, right? In case of infants, it is obtained from chorion frondosum, CHORION, chorion frondosum, 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 and from maternal uterine tissue, which is nothing but Deciduea basalis. Deciduea basalis from the maternal tissue, and chorion frondosum from the fetal tissue. So these are the components from which the placenta is being derived, right? And regarding the role of copper in collagen, right? So collagen is nothing but a protein. So copper acts as a cofactor for an enzyme called lysyl oxidase, which is important for post-translational modifications of lysine and hydroxylysine residues, thereby ultimately leading to formation or having this collagen structure. So copper acts as a cofactor for an enzyme lysyl oxidase, which has a role in post-translational modifications of certain amino acids which are essential for your collagen. Next. Yeah, hi Sita. Good evening. I thought you were sleeping. Okay, next. Who is a person whom do you call, what do you call a person who assists a dentist but doesn't operate independently, right? So we have options: assistant, denturist, auxiliaries. In fact, auxiliary is a generalized term which can be applied for both all the people who are working alongside with you in assisting. In the case, it's not just about dental assistants, but it can be receptionist, it can be a technician, anyone. So auxiliaries are nothing but alongside with you. Apart from you, those others are working in your clinic, right? As I said. So that's the meaning of auxiliary. Whereas denturist helps in making dentures, obviously, but in some countries, especially in some areas in US, they are allowed to even interact with patients. So in fact, they can work independently. But dental assistant is a person who assists a dentist but doesn't operate independently, right? So obviously, dental assistant would be more appropriate, right? Next, cyclic AMP, a secondary messenger. So regarding dental assistant. I hope you can see, right? Cyclic AMP, inosine monophosphate, which is a secondary messenger which is stimulated by glucagon to promote glycogen lysis, especially in case of your hepatocytes. Next, again, drug interactions between asthmatic drug aminophylline and antibiotics, right? We have a few options in antibiotics, right? So, which antibiotic interacts with asthmatic drug like aminophylline? So asthma and antibiotic combination. So you can just make a note, antibiotics such as ciprofloxacin, erythromycin, cimetidine and contraceptives, when they are given, they inhibit the metabolism of aminophylline asthmatic drugs and rise their plasma levels. Hence, the dosage of aminophylline in the question which they asked you should be reduced to 2/3 when you're providing a patient with antibiotics such as ciprofloxacin. Among options, I think you have ciprofloxacin, right? So these are the antibiotics: ciprofloxacin, erythromycin, cimetidine. Contraceptives also inhibit the metabolism, right? Yeah. They inhibit the metabolism and rise the plasma levels of your asthmatic drugs. Hence, the dose has to be lowered. So that's another interaction. The questions on drug interactions. Next, we had one question on soft palate configuration. So we have, if you refer any person on the complete denture textbook. So soft palate orientation. So we have type 1, 2 and 3, or class 1, 2 and 3. Class 1, horizontally oriented soft palate where you can go for placement of a broad posterior palatal seal because it is horizontal. Type 2 or class 2 is 30-degree angulated soft palate and class 3 is 70-degree angulated. And also in case of class 1, there is minimal muscular movement, right? So hence we can go for broad palatal posterior palatal seal placement. So one question on soft palate, right? Yeah. So soft palate type 1, so we have horizontal orientation of the palate, soft palate, and it exhibits little or least muscular movement. Arisha, I didn't get you which question you're talking about. As I said, I'm trying to comprehensively cover as many questions as possible, so I'm going at a greater speed. Because I've seen on the first day I could cover only 15 questions, right? So I'm trying to increase the pace. Anyways, don't worry. We'll try to have our own set of questions based on these topics and we'll incorporate them in our test series, right? Next, a question on true positive and true negative, okay, related to that. So we have something called as sensitivity and specificity. So sensitivity true positive, specificity true negative. I've rounded n's in both, sensitivity n, true negative n. So n and n do not coincide, right? So remember it that way at least. So sensitivity is nothing but the proportion of true positive cases in a given observation, observed values or observed sample, and specificity is the proportion of truly negative cases in a given observed sample, right? So proportion of positive cases or proportion of negative cases, sensitivity and specificity. Hi Neetu, hi Ananya, hi Preeti. Glad that you're still joining us live even after completing your exam. Yes, Preeti, I've seen your mail, by the way. I'll get back to you as soon as possible. Neetu, I'm really sorry because of time constraints. We had an internal exam today, so I couldn't really help you out in your references. If you still have any difficulty in finding any questions, do let me know in specific. I'll try to help you, right? Hi Mini, good evening. Hi Karishma. Hi Dhanlakshmi. Okay. Right. So next we have one question on methicillin resistant staph aureus or vancomycin resistant staph aureus, right? So MRSA, or see, the drug of choice, we discussed this yesterday. So MRSA resistant vancomycin. Vancomycin resistant, we can go for linezolid. Linezolid is considered to be more effective, and it comes under the category oxazidiones. It's really difficult to pronounce, and just make a note of it. So that class is considered to be a new class of antibiotics. Oxazidiones. Right? So these are considered to be effective, especially in case of superficial infections and gram-positive, including vancomycin resistant organisms, right? These can be given safely even in cases where patients have kidney dysfunction. This is very important. I think the question is related to that, right? So vancomycin resistant organisms, gram-positive organisms that are resistant to conventional antibiotics, linezolid is a drug of choice, and this drug can be given safely without altering any dose, even in cases of patients with renal dysfunction. Oxazidiones, no, I don't think so. In fact, I referred an article VA. It says oxazidiones. Anyways, I'll refer that if you want, right? Okay. Yes, regarding ideal cholesterol level with respect to CEJ, it's 1 to 1.5 mm. We have discussed that previously also. Next, regarding utilization after periodontal surgery, how much time does it take for utilization? So we had some questions on time periods like cleft palate surgery, periodontal surgery, like follow-up how many days, and also utilization how many days, right? Mostly memory based. So usually after scaling and root planing, you know that utilization happens within 2 to 5 days or maximum of 1 week. 1 to 3 days after surgery. So this time lag or timeline is very important. So periodontal surgery, utilization, let me just write down as utilization. Of the periodontal surgery. So 1 to 3 days after surgery, epithelial cell migration begins. 1 week after surgery, epithelial attachment is established by hemidesmosomes and basal lamina. 1 month, there will be formation of fully epithelialized gingival crevice, right? So, by the way, I am able to do this live session today in spite of time constraints because of my student Satyadev. It has helped me enormously in getting these references. So we worked extra time. In fact, he worked extra time. He spent 3 to 4 hours approximately, I guess. and he helped me in gathering these references and making my job easy. So I would like to take this opportunity to thank my student Satyadev for, I'm sure you're watching Satyadev, thank you so much once again. Right, so this regarding utilization after periodontal surgery, right? So we have this timeline, so you can refer Karanza, any standard textbook is of enormous help, and that's being proved time and again. The importance of notes referring standard textbooks is being proved time and again. Anyways, we'll have general sessions for our Mission Full Batch YouTube live on Jan 21st. We'll discuss all these again, right? Yeah. Hi Abhishek, good evening. Okay, Wasim says this year's paper is much easier. Anyways, we'll not go into that debate because again it's a incomplete question ever. It's all relative, isn't it? I might find it difficult, you might find it easy. It's all relevant. I'm sorry, relative. Okay, next. So recalling patients after periodontal surgery, I guess usually after periodontal surgery, normal post-op, we recall the patient after a week. In uncomplicated cases, we recall the patient after 3 months. In complicated cases like for patient involvement, we recall the patient after 1 month. So again, another timeline regarding recall after periodontal surgery. And the most commonly used composite restoration in terms of the monomer which is being used, most common resin, Bowen's resin, bis GMA, and also followed by dimethacrylate monomers like UDMA, 4-meta, and this. Right, we have all these options as well. Hi Sonali, good evening. Next, there is a question on over contouring of crown. So what could be the common cause of over contour? So over contouring, based on clinical experience, I can tell you, and based on the literature given, under preparation of the tooth would obviously lead to over contouring, which would have periodontal implications. We have discussed about this in significance of contacts and contours, right, previously. And also regarding a question on the fillers in composite. So obviously fillers, they increase the mechanical properties, right? So increase in the number of fillers would obviously increase the compressive strength, diameter tensile strength, noob hardness, reduces polymerization shrinkage. Because more filler, less organic, so organic matrix obviously will have comparatively lesser shrinkage. And when you use larger filler sizes, there can be plucking of the particles and they're more prone for wear and tear, right? So wear resistance decreases. Increased wear when the filler particle size increases, right? And then we had something called ring open polymerization. So ring open polymerization, there are latest advances where there will be opening up of the complex organic ring, thereby leading to minimal shrinkage. Because the major drawback of a composite is polymerization shrinkage, so that's being compensated by this ring opening polymers or ring opening polymerization. So we have radical, cationic, anionic, different types. We'll not go into details now. So ring open polymerization is useful in maintaining constant volume even after polymerization, hence reduced polymerization shrinkage, good mechanical strength. Examples: epoxy resin, dimethacrylate. Hi Farheen, very good evening. Next, iron deficiency anemia. Lab characteristics, very important. We had these questions in our test series, right? We repeatedly asking the standard questions. So iron deficiency anemia. So iron deficiency anemia lab findings include decreased ferritin, hemoglobin, as well as mean corpuscular volume, and increased total iron binding capacity, transferring and red cell distribution rate, which is a comparative analysis of the volume of RBC, right? And also something on acute dermatitis enterohepatica. It's a metabolic disorder because of deficient intake of zinc, also can lead to deficient absorption of zinc from intestine. It's a kind of dermal disease, skin disease, mostly because of deficiency of zinc. Yes, B. Yes, Preeti. Yeah, right. And also drug of choice in cases of acute diarrhea. Diarrhea. I always have this confusion with spelling. Okay, let me know if the spelling is wrong. Okay, so drugs of choice in case of diarrhea. So obviously, in case of non-infectious diarrhea, oral rehydration treatment is the only advocated mode of treatment, right? So preventing dehydration, making sure that patient is rehydrated time and again. But also, in case of this acute diarrhea, anti-motility drugs like loperamide, and also you have, apart from loperamide, anti-motility drugs. Yeah, also diphenoxylate, right? So these are all opioid receptor drugs, right? So opioid receptor agonists, anti-motility drugs like loperamide can be used, and they are of very much significance in case of your normal acute diarrhea, right? Anti-motility. But if it's an infectious diarrhea, if it's an acute infectious diarrhea because of E. coli or any other parasitic infection, then these anti-motility drugs are relatively, they are absolutely contraindicated, right? Because they can lead to prevention of draining of all these infectious organisms, thereby complicating the situation. So, in case of acute diarrhea, oral rehydration therapy is the treatment or line of treatment, and it helps. Objective is to prevent dehydration and promote rehydration. Anti-motility drugs like loperamide can be used. So examples of anti-motility drugs like loperamide, diphenoxylate, these are synthetic opioid receptor agonists, right? And these are contraindicated especially in cases of acute infectious diarrhea because they delay clearance of pathogen from the intestine, obviously, right? Yes. Okay, Rupali. Right? So right. So also there was one question on mode of inheritance, right? I would like to just highlight few important points pertaining to that. So, mode of inheritance, just keep in mind, if the mode of inheritance is autosomal dominant, then each affected person usually has an affected parent, and it occurs in every generation if it is an autosomal dominant disorder or inheritance of a kind of disease or disorder. So, in case of autosomal dominance, each affected person is usually affected, including the parent, and it is seen, and the trait or disease is seen in each generation. Autosomal recessive. Both parents of an affected person are carriers and not typically seen in every generation. That's very important. So both parents of an affected person are carriers. X-linked dominant. Females are more frequently affected. X-linked dominant. Females are most commonly affected or most frequently affected because all daughters and no sons of an affected man will be affected. And also, it can have affected males and females in same generation if the mother is affected. So let me just put that simple. X-linked dominant, females are more frequently affected because all daughters and no sons of an affected man will be affected. Because it is X-linked, not Y-linked. And X-linked recessive, males are more frequently affected. Affected males often present in each generation. And then also we have this mitochondrial inheritance pattern which can affect both males and females, but only passed on to the next generation by females, because all mitochondria of all children come from their mothers, can appear in every generation. So I'll once again summarize all that we have discussed so far. Autosomal dominant, each affected person usually has an affected parent, and this trait or disorder is seen in every generation. Autosomal recessive, both parents of an affected person are carriers, not typically seen in every generation. X-linked dominant, females are more frequently affected because all daughters and no sons of an affected man will be affected. X-linked recessive, males are more frequently affected. Mitochondrial can affect both males and females, but only passed on by females, as mitochondria of all children are derived from mother exclusively. Right? So this is in brief about various inheritance patterns and their characteristics with few examples. We'll not go into details of examples. Right? Anyways, we'll make sure that we have a separate video on this mode of inheritance soon. Right? Yes. Okay. So guys, I hope you've enjoyed these 3 days of discussions, and I'm sure yesterday's and today's discussions are quite fast, but as I said, because we had to complete most of the questions, and also we still have a lot much work to do, right? Lot many videos to focus on. So we're just trying to give you an overview of all the questions and topics, so that at least we'll know like what topics have been covered this year, right? So we'll see you again with more and more videos, and before leaving, we have 2 special guests today. So how are you spending your time? As one of you rightly said, it's really very boring when you don't have any challenge or any task ahead. Holidays are really very boring. 1 or 2 holidays during work time is good, but too many holidays is really, really horrible. Yes, so we have our first special guest, surprise guest. So do you remember his name? Hey, say hi. There is the guy. Say hi. So his name is Tiger, but I have named him as Megatron. He has grown a lot. When I showed you for the first time a few months ago, he was very, very tiny. Now he's almost double or triple the size. Tiger, say hi. So fluffy. Next we have our second chief guest, but not a surprise guest, as you might be seeing him every day, more or less. Yeah, Satyadev. By the way, as I said, guys, today's session is possible because of the support I got from Satyadev. Satyadev, once again, thank you so much for your dedication and for the effort which you have put in. I'm really impressed, and I'm very happy to have you as my student. Toffee, you should maintain silence when I'm talking. Yeah, say hi. Why are you looking that side? Okay, looking at the monitor. So one side Toffee and the other side Tiger. My house is now literally being stormed in all directions. Toffee. Okay. Sorry, Toffee. And Tiger. You saying something? Say bye. Say bye. See, I'm just Toffee. Okay, cool. So Toffee is getting angry now. So I should maintain silence. Okay. Right. Yes, Toffee is very jealous. Now they're fighting now. Right. Okay. So from this week, or for this January month, we're having live sessions only once a week. At the same time, we're also trying to give at least one or two videos, subject videos in our YouTube channel every week. So we'll be having around 2 or 3 videos every week, but only one live session, right? So for the month of January, because we still have a lot to focus on our e-classes and test series, so I'll be reducing the work which I'm doing or putting up in YouTube, because last 1 month I've been doing tens and tens of videos, right? So now is the time for us to focus on our e-classes as well as test series for sake of our registered students, right? So I hope you enjoyed all our live sessions. So we'll stop 2018 paper discussion with this third part, and it was really surprising to see the response for the previous 2 videos, and it's really very amazing. It's an amazing kind of feeling. Yes, you're welcome, BA, and I hope you're enjoying our sessions, and see you again soon with another live session. So this month, this January, we'll have live sessions only on Thursdays, 8 p.m. right? I have already made a poster and shared it in our YouTube channel. I'll circulate that once again. As I said, we'll have only one live session every week, mostly on Thursdays, 8 p.m. We'll do it from next week, because this week we have been busy with all this. From next week onwards, we'll have it on Thursday. You have any suggestions you want, any improvements to be made, or you feel like giving any feedback, you can always drop a mail at proudtobedentist@gmail.com, right? And also, as we have been discussing, we're starting with our Mission 12 batch in February. Orientation classes will be starting from 21st, that is Sunday, and we'll have an orientation exam on 28th. So orientation classes, will give you all the details pertaining to orientation classes soon in our Google group as well as in our WhatsApp update group, right? Yes, Manisha. So you should be obviously be knowing Satyadev, right? Yes. Muhammad, what do you want me to print? I said I don't have any questions. I said I have only topics which I have been discussing, right? Yes, Manisha, you're most welcome. I hope you joined our Google group and also WhatsApp update group, right? So that you can get regular updates regarding our live sessions. And you're most welcome. And Neetu, that's really great to hear, and thank you so much for your love and affection, right? And I'm telling you once again, I'm sorry I couldn't help you this morning. You have any questions, do let me know. I'll see if I can help you at least by tonight or tomorrow, right? Yes, Dhanalakshmi, you're most welcome. Welcome, Alvin and Rahman. Yes. So see you all again next week. Until then, take care. Enjoy your vacation. Those who are done with exam, or whoever have attempted the exam, right? Take break. Plan for a vacation seriously. We'll see you again, right? You will definitely come out in flying colors on 31st Jan 2018. Glad to hear that, Drisha. Thank you so much for your lovely feedback. This is what pumps me. Yeah, Farheen, now it's time for you to relax and forget about prosto and orthodontics, right? The most dreaded subjects. Okay, right. So I'll be seriously missing you all. Love you. Take care.